Hi, I'm Stephen Finn, and I'm here today really to talk about hearing loss. I do wear 2 hearing aids myself, and I'm sat here talking about it because I'm also involved in the procurement process for the audiology departments. As you'll know, because you're here watching this, the CCGs have come together to look at the procurement process for audiology, and I've been invited on purely as a lay representative with a hearing loss. So really what I want to talk about to you guys is the patient experience, what it means to have a hearing loss, and where I'm coming from. Now, you clinical professionals have a term, the patient pathway, and that is obviously when the doctor sees you and then sends you through the system, and you end up having an operation or having a hearing test and so on and so forth. And it's a distinct period. It's the patient pathway. The patient may have a much longer pathway. You may be looking back 5, 10, maybe even 20 years when you think, oh, something's not right with my hearing. And initially it's measured in nothing. It's measured in a few more extra pardons. What did you say? To turning up the volume and turning it up a bit more, to a point where maybe, in my case, your grandchildren won't come into the room because it's too loud, because and it's crept up on them. And then eventually maybe they listen to a bit of sense, go and see the doctor, get on the pathway, and eventually get to the hearing test. Because if you don't do that, if you're losing your hearing and you're not sure of it and you don't know where to go, you can become isolated, because you could, you're maybe an older person who is on their own, no one to say, go and get those ears tested. Then so you say, well, I'm not going to go out tonight because I can't really pick up the conversation. The pub's too noisy. I don't want to be involved. I can't keep saying, you what, pardon, what did you say? And you can really become isolated and withdrawn, so your quality of life goes down the pan, basically. So if you can get the hearing test done and you are diagnosed, as it were, and given suitable hearing aids to improve your hearing, that's great, but it's not quite the end of the story, because again, if you broke your leg and you went through the process, when you finish, when your leg's mended, there'll be other processes in, say, recuperation, and you'll be going to physio and you'll be improving. So to be given a hearing aid and say, put it in, great, you're fixed. You're not quite, because the sounds may be completely different. You may not be used to, what's that noise? Oh, it's a bird singing. I mean, it can be as fundamental as that. But also, there can be a cacophony of noise that comes in that you have not, for many years, processed. The brain picks out the conversation here, can sort of dampen down the noise in the restaurant, the background noise, and pick it up. You're getting that suddenly in one big flourish again, and you have to get used to it. So you do really need a good dose of help, in a way, to sort of say, look, these things will happen. Also, the actual equipment are quite delicate, and there's the hearing aid. In fact, I'll take one out just to show you. You guys will obviously know, but you have 3 components there. You've got the hearing aid, you've got the delivery tube, whatever you call it, and you have the thing that goes in your ear. Now, those, as you can see, are quite delicate, and people need to know how to handle them and use them to the best of their advantage. We changed the battery. Well, the battery, as again you will all know, is a diddy thing. And if, again, as you're getting older and you haven't got the dexterity, that could be a bit difficult to use. This needs explaining to people. This, you don't just give them the hearing aid and say, off you go, listen. There's the things you have to accommodate. And then maybe as well, whilst they're using it, excuse me while I put it back in, I don't know, I put it in this way, you guys tell me, have I put it in the correct way? Because, and if it doesn't go in right, it's not going to do its job properly. And so really the aftercare part of a hearing aid is just as important as having the hearing aid and obviously getting onto the system in the first place.